County to host the country director, Usaid, together with our partners in health, those who are supporting Ampath and supporting various programs in the county. And the basis or why we are meeting is actually to discuss how we are going to partner and work together as we implement the universal health care as a county. As you are aware, Ampath and MTRH has had a very long partnership in addressing and managing the issue of HIV and AIDS. And as a county, we want to work with them to help us with skill, capacity, and the experience, because we believe this is a model that has already been tested and it is working, and we can integrate it as we implement the universal health care. So we are having a discussion, and we believe in the near future we shall be signing an MOU with them, or now we are going to engage so that we can achieve the targets we've set for health.
Joint investments in Uasin Gishu, and to take advantage of the opportunities that exist to really leapfrog further improvements in the health sector, and to ensure that we build a sustainable system that is self-reliant, so that we can have a transition towards donor support and ensure that those gains are sustained over time. Really look forward to working with your team, with your strong leadership, not only in the executive branch, but our members of the assembly who are here with us, and really to ensure that all community members, the entire society can mobilize to achieve the ambitious and noble goals to achieve UHC in Uasin Gishu. So we look forward to our partnership and more to come.
When what the work that Ampath has put in this county in terms of HIV and AIDS has actually seen the suppression of the spread and the viral load in the county. But the statistics we have also been given are not very good towards the male gender. Not so many men go for testing, not so many men go for treatment, not so many men go to support groups, and therefore, even as the statistics of 86% is being talked about, probably 60% of that has been contributed by women. And we are telling the men in the country that, there will be no people in this country because it takes the men and the women to procreate. And therefore, we all must take responsibility if we have to continue the generations that are coming. We've made some progress. As you are aware, Trans Nzoia County was already putting up their level 4 facility. Initially, they had some challenges, but I think they have now been able to surmount those challenges. They are now at the stage where they are equipping their facility. We in Uasin Gishu, we had pledged to help MTRH acquire additional ICU beds. And I'm happy to report to you that already we've procured 5, and they're in the process of installation. Probably in another 1 week, we shall be launching those ICU beds. E10 County Hospital, was upgraded, and very soon I'm sure ICU facilities are going to be put there to manage emergencies before they make referrals to MTRH. So I think there's a lot of progress in those areas. We are also aware that now our Band Forest Hospital is now fully functional. Surgeons are able to carry some basic surgeries in those facilities now, and therefore the traffic to MTRH is going to greatly reduce. As counties evolve and as we strengthen our health systems in the counties, you'll begin seeing a reduction in the traffic to MTRH.
Yes,